what would a New Year's discussion be without talking about vitamin D? And again, the research continues to pile up on the utility of vitamin D for pretty much anything involved with physiology, but specifically to illness related to infection. And the new article I want to discuss is an article that looked at vitamin D and critically ill patients in the ICU and their outcomes based on mechanical ventilation. And we're all familiar with ventilators because of the happenings in 2020. And so this article is entitled "High Dose Vitamin D Improves Total Serum Antioxidant Capacity and ICU Outcomes in Critically Ill Patients." And what's important for those who aren't necessarily in the research all the time, this is a randomized double-blind clinical trial, or an RCT. And when you're holding up research to a group of people, oftentimes you could hold up a case study and they're like, oh yeah, that's great. That's a case of a few people, not that significant in terms of what it means for us. Let's see an RCT. So the scientific community looks at the RCT as the gold standard of research. And for the purposes of this study, then this was done with a methodology that is the highest standard they could possibly do according to the mainstream scientific community. So this was an RCT looking at high dose vitamin D and how does it impact patients who are on ventilators in the ICU. So let's dive in. The introduction says, mechanical ventilation can increase the rate of free radicals in the systemic circulation due to its effect on the inflammatory system. So let's think about a patient on a ventilator, right? If they're on a ventilator, they're critically ill. They're not doing well. Hence the study on critically ill ICU patients on ventilators. But if we learned anything from 2020, the layperson learned that if a person goes on a ventilator, they're doing really bad. And the reason they're on the ventilator is probably associated with what was called a cytokine storm or acute respiratory distress syndrome, ARDS. And we've covered this in previous videos. But ARDS drives the cytokine storm, which drives systemic inflammation. So the patients are put on a ventilator to keep them alive. But what this first sentence in the introduction says is that mechanical ventilation, the ventilator, can increase the rate of free radicals in the systemic circulation. So we're taking a person with massive inflammation, and as part of our attempt to keep them alive, we're actually creating more oxidative stress. And so, hey, if we can keep them alive, it's worth it. But it's just, understanding that the ventilator can contribute to the inflammation of the system. So we need strategies that can help decrease inflammation. It's not enough to just put a person on a ventilator in an ICU and say we're doing the best we can for them, right? There's got to be other things, and this study is looking at vitamin D as an adjunctive therapy to ventilation. And they want to know, if we increase vitamin D in these people, does that impact their total antioxidant capacity or their total ability to fight the free radicals that are present in the system and then that are increased due to the ventilation? And how does that relate to outcomes in the ICU for these patients? So metaphorically, I like to communicate to people that I work with that free radicals, oxidative stress are the same thing, essentially, right? So if you leave a steel bumper outside for long, it oxidizes or rusts, right? So in our body, free radicals are driving rust. Well, antioxidants, we take antioxidants to fight the oxidants or to fight the rust. So antioxidants in the form of, say, blueberries, blackberries, astaxanthin, CoQ10, whatever the fancy antioxidants you know about are, those are anti-rust molecules. Well, this study is looking at, is vitamin D an antioxidant? Does that help our antioxidant capacity? So what they did was they took 36 ventilated ICU patients and randomly allocated them to one of two groups, either the treatment group, which received one shot into the muscle of 300,000 IUs of vitamin D, or a placebo group. And then 7 days after the treatment, they measured vitamin D levels and total antioxidant capacity. And then they also looked at, pulmonary infection scores and sequential organ failure assessment daily for 7 days and on days 14 and 28. So how did they do in the ICU? 30 patients completed the study. The results show that injection of vitamin D leads to a significant increase in the mean changes of vitamin D level on the 7th day and total antioxidant capacity levels. So vitamin D injection of 300,000 IUs increased vitamin D. Well, good. We would hope so, right? And it also increased total antioxidant capacity. So it helped us fight the rust, which part of the rust was being caused by whatever disease process led to them needing to be on the ventilator. And then the ventilator causes more rust. So vitamin D is effective in increasing our antioxidant defenses. The intensive care unit, the length of stay in the ICU was 18 plus or minus 8 days for the vitamin D group versus 25 plus or minus 6 days for the placebo group. So the length of time in the ICU was shorter for the D group versus the placebo group. And then interestingly, 12 patients in the placebo group passed away, whereas only 5 in the vitamin D group passed away in that 28-day study period. And then lastly, mechanical ventilation or the ventilator. The vitamin D group needed the ventilator for 15 plus or minus 9 days on average, whereas the placebo group needed it an extra week, so 22.6 plus or minus 9 days on average. So the conclusion of the study was that giving vitamin D may increase total antioxidant capacity levels and decrease length of stay and duration on the ventilator in ICU patients. So another one in a long line of studies showing that vitamin D is very, very useful for people of all ages, from birth all the way up to critically ill intensive care unit patients. And so I think this study snaps right into studies we've covered previously about vitamin D's usefulness for acute respiratory distress syndrome, or ARDS. Remember a few weeks ago, we looked at studies showing that if you're vitamin D deficient, that contributes directly to ARDS, or lung inflammation that requires ventilation often. Okay, this was another study, vitamin D deficiency promotes ARDS. And then the most recent study was that insufficient vitamin D levels may account for up to 90% of COVID deaths. And so those authors from that study concluded that to withhold vitamin D is highly debatable and potentially even unethical. So, the studies continue to pile up that vitamin D is key for us in multiple ways physiologically, but for what's been relevant for the last year and from a societal and public health standpoint is it could be an inexpensive, very powerful strategy to prevent death. And then we can see it can prevent length of stay in the ICU and length of ventilation. So in every way, it appears that vitamin D could make things easier, take the burden of sickness off society for us, take the financial burden of, hospital stays and ventilator usage and, deaths that occur from the chronic diseases that are rampant in society. So the last thing I wanted to point your attention to is the study did one intramuscular vitamin D injection of 300,000 IUs. So, to take that orally, that would be 150 drops of 2,000 IUs. Many vitamin D supplements have, many vitamin D liquid supplements have between 1 and 2,000 IUs per drop, and many bottles have 500 drops per bottle. So 150 drops of a 2,000 IU bottle would get you 300,000 IUs, and you'd still have, 2 more doses at that level if there was 500 drops per bottle. So, I don't know, it'd be interesting to see a study compare oral administration to intramuscular injection and see if similar or better results were observed. So let's open it up to questions and comments.
Seems like such a very inexpensive way to save someone's life.
Yeah,
Yes.
I agree. And it's actually, you know, there's some lip service to this, or some action taken toward that end, but it's been weak. In early December, the UK announced that they were going to give a 4-month supply for free of vitamin D to everyone in the UK. I believe it was age 65 and older. So,
Yeah.
you know, the government was going to pay for that, and which is peanuts. But, you know, so they did the right thing, but the dose they gave them was 400 IU a day for 4 months. Well, that's 10% of what the average person needs. So, you know, they didn't give them enough ultimately. It looked like a good thing. It gets them all kinds of press, but it's like, well, you gave them not enough to move the needle insufficiency wise. So, you know, most of those people won't really be any better. And then, you know, the danger is then retrospectively they go back and say, well, we spent the state's money to do this and we didn't prevent anything and no one was better. And it's like, but you're not reporting that you gave them 10% of what they needed, right?
What would you recommend as a daily dose? And do you think it's better to do like a higher dose every other day? I've heard some talk about that.
It just varies based on the individual in terms of dosing, because where their level is would determine how highly we want to dose and for how long. But research on vitamin D suggests that adults are safe to take 4,000 IU a day.
Yeah.
And actually not safe, but it's actually, you know, that would be the RDA. Whereas most labels say 400 IU, you know, that's 10% of what we need. So 4,000 would be break even, because you have to remember vitamin D level is dynamic, right? It has a role in bone physiology as an anti-inflammatory, as an antimicrobial, and dopamine signaling, and keeping gut barriers tight or lung barriers tight. So it has a lot of jobs, and the more jobs it has to perform, the more you're metabolizing through it. So you can't take 4,000 once and be like, yeah, I'm good. My D's good, right? We have to keep up with it. So if a person's more inflamed, it's likely that 4,000 is not enough, right? And if they're chronically inflamed for a long time, like most Americans, you know, you're smoking through it, you're not getting any from your diet, and the sun's not providing enough. So, hey, 1 billion people on the planet are deficient in vitamin D. How'd that happen? You know, and then our nice governments give us 400 IU to try and make up for it. It's like, thanks.
Are there any studies that are done? Because it was interesting with that study, they just did one high dose injection. Like I wonder about doing another one a week later, or, you know, more than just a one-time shot. Have you seen studies about that?
I haven't. That doesn't mean they're not out there. I just haven't necessarily looked at that. It would be interesting. I'm sorry?
Do you know what I'm talking about? GrassNet that does the testing for you, and they publish all the studies on vitamin D. They also look at it in terms of prevention of things like breast cancer, at what levels, and publish all the studies on that. They're a great vitamin D resource.
You said GrassNet?
Grassnet.org.
Okay, thank you. I've never heard of that.
Remember the test that I had done independently when I first came to you? Those were all done by them.
Okay.
The blood test that I had.
Okay. Yeah, thank you, Vicki. Robin, my suspicion is that it would you know, it would obviously be better. What I'd like to see in this study, I don't have access to the full text of this study yet, but I'd like to see, I wonder if they show the pre and post vitamin D levels, like vitamin D on entry to the hospital, vitamin D the week after the 300,000 injection.
Right.
Because that would be helpful. And they said that it led to a significant increase in the vitamin D level. So what does that mean? And we can't assume anything, because oftentimes in a mainstream clinical environment, if your vitamin D's 32, they tell you you're fine, whereas 29 would be lab low. So I want to see the actual numbers to see, you know, what does that mean? It says here, like, for example, it led to a significant increase in the main changes of vitamin D level. Well, 3.5 plus or minus 1. I mean, that's not significant, right? So we took you from a 33 to a 36. I mean, statistically, that's significant for the study, but physiologically, a 33 or a 36, those are both insufficient.
Right.
Make sense?
And I wonder if they had that earlier, like at the point that they're in the ICU and they're going on a ventilator, that's a pretty far down the road. Like,
Right.
I wonder if they had, either the preventative vitamin D or the first signs of illness, if they'd had more on board sooner, might they have avoided getting to such an extreme situation?
Yeah.
There are a couple of hospitals that are testing patients coming in now to check their vitamin D levels when they're admitted so that they can do more studies on that. But there are a lot of people that are doing that now, I think.
That's cool.
That's
even Fauci's recommending vitamin D now. I mean, it's what was fringe is now becoming mainstream.
Yeah, Fauci, you don't. I mean, if he talks enough, he's going to get something right? So he finally did. But we've been right in saying this since before all of this started. So take him with a grain of salt. But yes, the
point is that now it's become common knowledge, mainstream awareness, rather than just people like you.
Correct. So that part's good, and it's really good that I like where your line of thought is, Robin, with all this, and it's great that the hospitals are doing that admittance testing, because that helps us understand the question you have. What was it on admission? And even better, like you said, would be too bad the yearly physical everywhere doesn't include vitamin D, so that we knew, okay, this person for 10 years had a D like this. This year they declined rapidly, entered the hospital, needed a ventilator. So you have data points to help understand that picture more.
Yeah.
So awesome comments. What else?
Well, that's kind of a question that I had in the back of my mind. When you start taking supplements and vitamins, how long does it take to actually get into your cells? So I guess this took about 7 days. At least they tested after 7 days.
Yeah, but remember they injected it directly, which is going to have a different absorption rate potentially than sublingual or capsule or however you're taking it. And then the individual's physiology matters. So your inflammatory level matters. We have what's called vitamin D receptors, and the receptor efficiency is partially controlled by genetics and then partially controlled by epigenetics. So all of those factors matter as well. And
I have a comment relative to what was just said. I've been taking a good high bioavailable vitamin D drops for a really long time, but how big is a drop? So my drop probably was too big because my level was up to 95, which Dr. B is like, oh, we got to back off of that, because I think there's, for some people, something called a cytokine storm that you can drum up when you have vitamin D up the yin yang.
I haven't seen any data that vitamin D drives a cytokine storm. But we don't want vitamin D too high, because we don't want, so there's physiologic inflammation, right? So
yep.
Well, let me get my pen out. Where are you? Here you are. So if we have, the famous seesaw, right?
Yep.
And if we make it a vitamin D, or let's make it an inflammatory seesaw, we want to have inflammation versus anti-inflammatory capacity. And both are necessary. And at a resting physiologic state, you've got both going on, right? And it's in a dance that allows you to be healthy. Whereas if we're chronically inflamed, right, that obviously leads to disease. But if we can't mount an inflammatory response when we're inflamed, that's not good either, right? And that can lead to cytokine storm, because hey, we get an infection that, well, all of us were mild or asymptomatic. Why did you end up on the ventilator? perhaps your inflammatory seesaw was such that, you know, your anti-inflammatory capacity was too low and your pro-inflammatory capacity was too high. Or another thing, we could flip it. Maybe your anti-inflammatory capacity is too high because, say, your vitamin D is really high, your omega-3 fatty acid level is really high. And so you contract some sort of infection or injury, and now you can't mount that the inflammatory response that we need to kill an infection or to resolve traumatic inflammation. So you stay inflamed, or so the microbe gains more of a foothold before you get an immune response. And so a case that should have been mild or asymptomatic is now more severe. Does that make sense?
That does, but is that to the point that vitamin D levels ought to be not that high?
Potentially. It depends on the rest of the physiology.
And oh, by the way, I'm just looking at half a dozen studies at the NIH correlating vitamin D status in cytokine storms.
Hmm?
There is some research out there.
But is it correlating low D with increased cytokine storm?
Yes, no, high.
High D with increased cytokine storm?
Yeah,
Interesting. Will you send me the link to that,
yeah, sure.
please?
Yeah.
So yeah, that's interesting. I know there was some conjecture early on, you know, with the COVID stuff. You know, the ACE2 receptor is one of the receptors that the virus targets on our cells, and vitamin D interplay with the ACE2 receptor. There were some studies showing if your vitamin D was too high, that could increase ACE2 response and actually increase viral success, so to speak. So again, it's usually not a linear thing. It's kind of a just right thing. We don't want too much, we don't want too little. Because if we have too little vitamin D, if we have too little vitamin D, look, you're also at risk for cytokine storm.
Yep.
So it's more of a Goldilocks thing. We want the middle bed. And then the middle bed size will vary per person, you know, the size being what's the bullseye target for your vitamin D level. And even Linda, your bullseye target vitamin D level today could be different for you than it is next year, right? So this is why it's hard to you know, go into an ER, go into a doctor's office, and here's the protocol, here's what we do. And it's like, but this person entered the protocol at a different point than the last person, you know?
Yep.
Vitamin D is seasonal as well.
Yes. Yep. She said vitamin D is seasonal as well because there's the sun contribution. And in winter months, there's more deficiency, and latitude can play a role. Skin tone can play a role. Diet plays a very minimal role. But yeah.
Mine went up 15, almost 20 points over the summer without changing anything.
Mm-hmm.
I mean, I'm taking the same thing. I went from 67 to 105 because I was outside a lot, I'm assuming.
Yeah, and that would suggest that you're very efficient at converting it to a useful form versus, you know, an African-American person outside just as much as you could still be deficient.